Hello everyone. In this video, I'm going to tell you about the different types of cardiac implantable electronic devices. I'll be telling you about pacemakers, cardiac resynchronization therapy devices, implantable cardiac defibrillators, and loop recorders. If you're new to the channel, I'm Hafiz and I'm a cardiologist training in London. Here I explain heart conditions in a way that I hope is easy to understand, and I also provide teaching for medical students and junior doctors. If you want to know more about your heart and learn about heart disease, then hit the subscribe button and bell icon so you get a notification every time I post a video. Okay, let's get back to the main topic. Your heart has its own natural pacemaker to regulate each heartbeat. This is normally generated in the sinoatrial node located in your right atrium. Due to aging or due to an underlying disease, your own natural pacemaker can fail to generate an electrical signal. When your natural pacemaker isn't working properly, then you may require a pacemaker implanted to restore the heart's natural rate. Pacemakers work by sending controlled electrical impulses to regulate the heart rate and stimulate the heart if it's beating too slowly, called bradycardia. A pacemaker is composed of a pacemaker box or generator, which is about the size of a stopwatch. They are battery run and connected to the heart by pacing leads threaded through the veins to the heart, and they carry the electrical signals to the heart. The first pacemaker was implanted in 1958 in Sweden in a 46-year-old man. The patient survived to age 86 but required over 20 procedures as the battery life wasn't long enough in those days to sustain the device for long periods of time. Since the development of lithium batteries in the 70s, this greatly increased pacemaker longevity, therefore allowing fewer procedures. Today, pacemaker batteries last for around 5 to 10 years, at which point the generator needs to be replaced, which requires another procedure. Pacemakers are traditionally implanted under the skin in the left upper chest, just above the collarbone. A conventional pacemaker is performed under a local anesthetic, so you'd be awake, and the procedure takes about an hour. Patients can usually go home same day after having a chest x-ray performed to ensure correct lead positioning and look out for any potential complications. You would also have the pacemaker checked by a cardiac physiologist to ensure the device is working correctly. It also monitors the electrical activity and tailors the function of the pacemaker according to the electrical activity of the heart. So if the heart is working perfectly, then the pacemaker does not need to deliver an electrical signal. There are a few different configurations of how the leads are implanted into the heart. You can have a single chamber pacemaker, dual chamber pacemaker, or biventricular pacemaker. Single chamber pacemakers have a lead in a single chamber, either in the right atrium or right ventricle. They are placed in the right atrium if the AV conduction is normal and the issue is in the sinoatrial node. If the AV conduction is abnormal, the lead is placed in the right ventricle, bypassing the right atrium, therefore stimulating the right ventricle directly. Dual chamber pacemakers have leads in the right atrium and right ventricle, allowing the pacemaker to synchronize the contraction of the atria and ventricles. Biventricular pacemakers have a lead in the right atrium, right ventricle, and left ventricle. They are also called cardiac resynchronization therapy, or CRT pacemakers. Cardiac resynchronization therapy is used for patients whose heart function is significantly impaired, but also inefficient. If you have heart failure, then the two ventricles of your heart are beating out of sync. A third lead is added into the left ventricle. The device will send electrical signals to the right and left ventricles to coordinate each heartbeat, to resynchronize them so that each heartbeat is more effective. This type of device can also act as a pacemaker or a defibrillator, depending on the indication. There are strict criteria based on the ECG as well as imaging and clinical factors to determine if you will benefit from this type of device. There is also a leadless pacemaker, and as the name would suggest, it has no leads. These were developed to reduce lead-related pacemaker complications. They are about 5 centimeters and implanted directly into the right ventricle, delivered percutaneously through a small incision in your groin. The leadless pacemaker is deployed into the wall of the right ventricle via the delivery catheter threaded through the femoral vein. But not everyone is a candidate for a leadless pacemaker. They are currently only used for single chamber pacing. Okay, let's now talk about implantable cardioverter defibrillators, commonly known as ICDs. ICDs continually monitor the heart to check if your heart is beating too fast, called tachycardia. The device will send painless electrical pulses to correct the heart rate, called anti-tachycardia pacing, or ATP. If the rapid heart rate continues, the defibrillator may deliver a shock to restore the heart to a normal rhythm. It will deliver a shock if the heart goes into dangerous heart rhythms, such as ventricular fibrillation or ventricular tachycardia. These rhythms are not compatible with life, so the device shocks to restore a normal heart rhythm. This can be life-saving and the main indication for defibrillator implantation. There are 2 types of ICDs being implanted: transvenous ICD and subcutaneous ICD. In a transvenous ICD, the lead is threaded through the vein in a similar way to a conventional pacemaker. Although the traditional approach, the main issue with transvenous ICDs is lead-associated complications such as lead malfunction due to fracture or displacement and risk of infection, which may require extraction of the lead and therefore another procedure. The subcutaneous ICD is a less invasive approach where the wires are implanted under your skin instead of being threaded through your vein. And because there are no leads actually placed into the heart, their removal or replacement is much simpler, therefore reducing the potential risk of infection. Finally, there is a device called an ILR. An implantable Luke recorder, or ILR, is a device about the size of a computer USB device. They're used to investigate causes of blackouts or dizziness, which may be episodic and difficult to capture by conventional 24-hour or 1-week Holter monitors. They are for diagnosis purposes only and not used to deliver therapy. It records your heart rhythm continually for up to 4 years. The device can be interrogated throughout this time to look for any abnormal heart rhythms. Implanting these devices requires a small incision made on the skin, and the device sits under the skin over the heart. The whole procedure takes about 15 minutes. Having a device implanted in the body is a big decision, and one that shouldn't be taken lightly. I think it's important to say that all these devices have associated risks, shared risks being bleeding and potential infection. They also involve an incision on the chest, and the silhouette of the pacemaker is visible with a slight bulge on the chest wall, which may not be cosmetically desirable, and that's important to some people. There are also serious potential complications specific to each device that needs to be discussed with your healthcare provider. They may be contraindicated in MRI scans due to the powerful magnets in the MRI. Most modern pacemakers are MRI compatible, but it's essential to check both the pacemaker and the leads to ensure they are MRI safe before organising this type of scan. So it's always worth having these discussions with your healthcare provider so the best approach is selected for you. But having said that, these devices can be life-saving and improve quality of life. So to summarize, there are different types of cardiac implantable electrical devices. A pacemaker is implanted to protect you from a slow heart rate. A cardiac resynchronization therapy device or biventricular pacemaker coordinates the left and right side of the heart so your heart beats effectively. A defibrillator is to protect you from fast, life-threatening heart rhythms. And finally, a loop recorder is for diagnostic purposes only to identify any potential rhythm abnormalities that may require pacing. I hope that was helpful, and thanks for watching.